Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon. I'm so very pleased you could be with us for our next segment. I'd like to take a few minutes to talk about body contouring. Body contouring is one of the most common issues that I see in my practice in plastic and reconstructive surgery here in Monterey. People will come in and ask about liposuction. They'll ask about tummy tucks and thigh lifts, and more recently they ask about cryolipolysis, and we'll be able to touch base on that, this new system called cool sculpting. So let's start by talking about the different ways that we do body contouring. To begin, I want my patients to know that there are two general ways that we do body contouring or body sculpting. There's the open approach and there's the closed approach. What do I mean by the open approach? The open approach is when we make incisions, typically long incisions, and we can remove blocks of skin and fat. And when we do that, or while we do that, we can go inside and tighten up a muscular layer. For example, when we do a tummy tuck or abdominoplasty, we can remove a big block of skin and fat, and then when we get inside, we can tighten up the abdominal wall, reinforce and shorten or strengthen, reinforce the fascia. And we don't actually tighten up the muscles themselves, but we tighten up the fascial covering or the abdominal wall. Now, I'd like to talk about that for a couple of minutes. Now, what do we mean by the fascia? The fascia is a connective tissue, collagen layer that is found in many different parts of the body, and it's found covering muscles. If anyone listening or watching eats steak, you'll know what the gristle is. The gristle is one example of a very tough fascia. It's overlying the muscle. There are often, in other parts of the body, there are very thin, fine layers of fascia that don't have a lot of strength, but they do help to keep certain organs and define, they help to keep organs in place, and they help define tissue planes and can help divide up compartments. So when we do a tummy tuck, for example, in a woman who's been pregnant a few times, and her abdominal wall gets stretched out, she can do sit-ups to beat the band, so to speak. The fascia, once it's stretched out, doesn't really bounce back. It doesn't have the resilience to go back to its original strength and integrity and size. And so hence when we do a tummy tuck, after removing a big block of skin and fat, we can tighten up the fascia. And that's done with sutures, typically non-absorbable or permanent sutures. So that's an example of an open approach to body contouring. And the advantages are, of course, we can remove big blocks of skin and fat, and we can tighten up muscles or tighten up the fascia on the inside when we do that. The disadvantage is, of course, it's a little bit of a more involved procedure. The recovery period may be longer than liposuction. And most importantly, it leaves a long, permanent, visible scar. By definition, even when a plastic surgeon makes an incision, it leaves a permanent, visible scar. So for example, with a tummy tuck, thigh lift, buttock lift, etc., even breast reduction, those incisions leave scars, even in the hands of a plastic surgeon. Now, of course, plastic surgeons are concerned with scars, and we do our best to minimize them, and there are ways that we can minimize scars. However, scars can be unpredictable, and so I want my patients to know if that person, he or she, undergoes a body contouring with the open approach, there will be scars. For example, when we do an arm lift or brachioplasty, oftentimes a person will be concerned with the loose skin of the upper arm. That's called a brachioplasty. We can do that, but it leaves scars. Now, that's the open approach. What about the closed approach? Essentially, the closed approach is liposuction, whereby a plastic surgeon will make a very small incision and insert a cannula. It's a tube, and that tube or cannula is connected to a suction, and by moving the cannula properly, we can vacuum out fat cells. Now, the advantage is we can remove a lot of fat cells with liposuction, and of course the scars are small. Even though they're permanent visible scars, they're very small and can be typically hidden or disguised. Those are advantages, small scars and the ability to remove a lot of fat cells. The downside is we can't remove skin. By definition, if all I do is to make a very small incision, then I can't remove skin. Now, some people will come into my office And the program that we design for them has to be custom designed, of course, because everyone presents with a different body habitus and weight and pregnancy history, and everyone has different goals. But essentially, a person needs to be evaluated if they're a candidate for the open approach or closed approach. Some people get both. Some people just get liposuction. Some people just get an open approach, which would be a tummy tuck. Some people get both, so there are combination approaches. There's a newer treatment that we're just introducing now called cryolipolysis. Now, what is that? First of all, the principle of lowering the temperature of a fat cell is something that we need to talk about. When the temperature of a fat cell is lowered, it's very sensitive to the ambient temperature or surrounding temperature, much more sensitive than the surrounding cells, for example, a muscle cell or skin cell. So cryolipolysis or cryolipolysis or cool sculpting involves actually making no incisions. But a person will lay in a machine or lay against a machine. There's a suction device that will actually suck in the soft tissue temporarily, suction in a roll of the soft tissue, for example, a love handle, or the lower part of the stomach, the lower part of the abdomen. And that tissue stays within that suction area for about an hour. The machine lowers the temperature of the fat cells, that tissue, to about 55 degrees or 50 degrees. What a couple of doctors and researchers and scientists at Harvard discovered is when the temperature of the fat cells is lowered to about 55 degrees, after that 1 hour treatment within the device, within the machine, in the next few weeks to months, the fat cells undergo dissolution or lipolysis. They dissolve, and the fat is just metabolized in the body, and about 25% of the thickness of that subcutaneous fat will be eliminated or reduced. So again, it's a new type of treatment, cryolipolysis or cryolipolysis, whereby a person is near or sits within this suction machine. A love handle or the lower part of the abdomen is suctioned in. There's no incisions made, no anesthesia. The temperature of the tissue is lowered to about 55 degrees, and thereby the fat cells will lyse or dissolve over the ensuing weeks to months. Now, it's not a substitute for, I would say, more invasive liposuction or an open approach. However, but for the person who just has a very limited area, doesn't have a lot of fat to be removed, I think it can be very appropriate. Of course, it's a new treatment, and we're still analyzing it, and we're seeing how it's going. But so far, the early reports are really encouraging. Again, approximately 25% of the thickness of that subcutaneous fat will be diminished with the cool sculpting or cryolipolysis. Again, it's done in the office. A person is awake. There's no anesthesia. I think that most people find that it stings a little bit. It's somewhat uncomfortable at the beginning when the suction machine is applied. However, with the cooling protocol, as tissue is cooled, then the pain goes away. It takes about an hour, and of course we monitor people, and then they just leave and go about their business. And in the course of the ensuing few weeks and months afterwards, then the fat cells will undergo lysis or dissolution. So, to recap, the open approach of body contouring is when we make incisions. We can make long incisions to remove big blocks of skin and fat. We can tighten up muscles and fascia at the same time, if need be, with permanent sutures. And the advantages are we can remove big blocks of skin and fat. We can tighten up muscles and fascia while we're there. The disadvantage is, of course, it's more of an operation, typically requires an anesthetic for a tummy tuck, and it leaves a long permanent visible scar. Liposuction, or the closed approach, we make very small incisions. We insert a tube or cannula connected to a vacuum, and we can vacuum out fat cells. Now, for small areas, small to moderate areas of requiring liposuction, I do that in the office. There are state regulations that, of course, we follow quite closely. For small areas, we can do that in the office. For more moderate areas requiring liposuction, a person will go to the surgery center or hospital. That's for up to 5,000 cc's of liposuction. That can be done as an outpatient, typically with some anesthesia. California regulations require that for more than 5,000 cc's of liposuction. That's quite a bit. For more than 5,000 cc's, typically a patient will stay overnight and be monitored, whether it's at the surgery center or at the hospital. And finally, what I mentioned today, a more recent development, is the use of cryolipolysis or cryolipolysis, cool sculpting, which is the use of a machine to cool down the fatty layer, cool down the soft tissues to about 55 degrees, and thereby over the course of the next few weeks to a few months, the ensuing few weeks to months, the fat sort of dissolves and the body metabolizes it. So, what are some of the specific areas that we see for body contouring? I mentioned tummy tucks or abdominoplasties. Typically, if someone has been pregnant, if a woman that I see in the office has been pregnant and she has lots of stretched out skin and a lax abdomen, then I'll recommend that she consider at least a tummy tuck. Now, we may augment that with liposuction, particularly in the areas of the flanks. Typically, what I call the flanks are the lower flanks, the lower part of the back, the love handles. I'll oftentimes liposuction that area, and I won't have to extend the skin incision around posteriorly very far. It is one way that we can help keep the scar short. But again, scars can be unpredictable, but it certainly will make a scar of variable length on the anterior abdomen, usually quite low, to remove a big block of skin and fat. Now, the mini abdominoplasty really is a way that we make a shorter incision. We can combine that with liposuction. We can do limited tightening or reinforcing of the abdominal wall fascia. But it's a way that we can get improvement in an abdomen, improvement in the tummy, and not make a very long, extensive incision and scar that goes around to the back. So, oftentimes people who are younger or who have not been pregnant and who do not have extra skin will more likely opt for the liposuction. That's because we don't need to remove extra skin. We can simply accomplish someone's goals by removing some of those fat cells in between the skin and the muscle. Now, to kind of review how that works, with liposuction, we can picture the abdominal wall covered with fascia, or the muscular wall covered with fascia, and we can picture the overlying skin. In between the muscle and the skin is the subcutaneous fatty layer, and it's that layer that we can affect with liposuction. What we're essentially doing is moving the skin closer to the muscular wall, closer to the abdominal wall, for example, by liposuction, because we remove the fat cells and thereby allowing the skin to come closer to the muscular wall. Now, I do want to take a moment to talk about something. We need to distinguish very carefully between intra-abdominal fat, for example, a very large omentum, the fat that's contained deep within the gut inside the muscular wall, as opposed to the subcutaneous fat. And through a careful physical exam with an experienced plastic surgeon, someone experienced in body contouring, you can get an idea beforehand of realistic expectations. Because with either of these procedures, and actually any three of these procedures, whether it's liposuction or tummy tuck, the open approach to body contouring, or even cool sculpting, we're not really affecting the intra-abdominal fat. Oftentimes in men and in some women, they feel they have a protruding abdomen and they'll come in for a tummy tuck or liposuction. And if they have a very large omentum or quite a large amount of intra-abdominal fat, neither of those procedures, or not one of the three procedures I mentioned, will effectively make an omentum get smaller or diminish the intra-abdominal fat. And that's very important to distinguish in the preoperative counseling and consultation session. If you have questions about the open approach to body contouring, tummy tucks, brachioplasties, arm lifts, thigh lifts, or if you have questions about liposuction, whether it's the love handles or under the chin, in the neck, or up the arms, or if you have questions about the cryolipolysis, the cool sculpting approach to body contouring, please visit my website, drmorwood.com. That's drmorwood. That's drmorwood.com, or call my office, 646-8661. That's 831-646-8661. I'm Dr. David Morwood. I am a board-certified plastic surgeon here in Monterey, California. Thanks so very much for being here. This is Your Health television program. Please visit us again soon.